So, thank you for having me. My name's Alex Reed. I'm the CEO of Wellness Lifestyles. We're a venture-listed company listed under the symbol WELL. Nice and easy to remember. Hope you're all doing well today. So, we're an accretive, disciplined, M&A-focused company operating in the Canadian healthcare space. We own, operate primary healthcare facilities, and we're layering in digital technologies to evolve and modernize how healthcare is delivered within Canada. And I've just found the ticker on my table. This is exciting. So, who here has ever been to see a doctor? Put your hand up if you've ever been to see a doctor. Don't worry, I'm not going to ask you why, but hands up if you've seen a doctor. There's a lot of very well people here. There's a lot of hands down. Okay, so most of you are going to understand that there's a lot of opportunity for changing how healthcare is delivered within the Canadian market space. However, before I talk about that, what I'm going to talk about is what I call the 3 key pillars of success in any company. And I'm sure you're all already aware of this when I lay it out, but number 1, you've got to have the right people with a proven track record of success. Number 2, you've got to be operating in the right market with great potential for what you want to do. And the third thing, the third pillar of success, is you've got to have the right strategy to go and attack that market. So I'm going to talk quickly about all 3 elements. Hopefully I pressed the right button here. There we go, we can skip the disclaimer. So number 1, having the right people in place. We've taken at Wellness Lifestyles the time to develop the right talent in our organization. So starting with myself as CEO, yes, that is a 10-year-old picture, but I swear I still look the same. Maybe, put my glasses back on, I don't look the same. So myself, I'm a lifelong entrepreneur. I've built, scaled, sold multiple different companies. My whole background is growth through duplication, setting up a template and then rapidly duplicating really quickly. Companies I've helped in the past, 1-800-GOT-JUNK, we scaled that to over $100 million a year, 300 franchise locations. I still own New Jersey over on the East Coast, so if anyone wants to talk about waste removal in New Jersey, yeah, I have several jokes that we can share. Also scaled and grew Foodie, food delivery company, across 10 markets across North America, and then had their Series A financing. And background at American Express, where we did global re-engineering, so basically making the company quicker, faster, cheaper. Our CFO, Brian Levenkind, deep experience in the medical field, in public companies, ex-partner at Grant Thornton and KPMG, great person to have involved. And then on our board, we have a lot of people, some faces that you probably already know. Our lead investor, one of our key directors, Hamid Shabazi, who's in the audience here. Thank you, Hamid, taking some pictures. Obviously, as most of you know, had a hugely successful run building and growing TO networks and then selling that to PayPal successfully last year. And then a couple of other people with deep public company experience and growing companies quickly, but accretively and with great focus on shareholder value. That's Ken and Peter. So we've really taken the time to develop the right people. Next part is the market. Obviously operating in the right market. We're in the Canadian healthcare space, but just touching on the US healthcare space for just a second, it's a $5 trillion a year health ecosystem in the US. Now, within that, it's an industry that's ripe for disruption with some of the digital technologies that we've been learning about here a lot today. So this is an industry that's going to change seismically over the next few years. Now, $2 trillion of that in the US is based on care delivery. What we talked about earlier, going to see your family doctor, going to see a local physician. But how does that equate to Canada? Well, in the Canadian healthcare market, care delivery is a $242 billion a year industry. Now, this is Canada. You may note that I'm not from Canada originally, from the UK, but Canada's not a huge global market. But to have an industry that's at $242 billion a year and growing year over year in Canada is a huge industry sector in Canada. So we see a lot of opportunity in this growing industry, which is really a sizable chunk of the Canadian economy. So that's the market. But what about our strategy for execution and successful execution within that market? So we've got the right people, we're in the right market. Our strategy for execution, like I said, we're an M&A-driven company. But our philosophy really is following companies like TO Networks. The great run that they had, obviously, overnight 20-year success story. The last few years of TO, they really did find their stride in terms of that accretive, disciplined M&A strategy, really looking for the right M&A transactions and really adding that into their portfolio for growth. So we're looking at following models like that, and we can talk about other companies like Acuity Ads and other venture-backed companies that have been doing really well with their M&A strategy. But we've got an M&A philosophy that follows people that have already done the right things. So what are we actually doing with that acquisition strategy? Well, as I said, wellness lifestyles, we're actually looking, or what we are doing is acquiring a portfolio of primary healthcare facilities, family doctor practices. We're building this base platform of family healthcare practices and then layering on disruptive digital technologies that are going to enhance how healthcare is delivered within Canada. So we take these profitable clinics, we help, obviously, create efficiencies on the back end to help doctors essentially be better at what they do, which is being doctors and providing great patient care. And then on the patient side, we're utilizing technologies to really ensure that the quality of care is improved. One great example, telemedicine, it's up on the screen there. One of the reasons I mention that is because the adoption rates of telemedicine within Canada are really, really low compared to the US, for example. And in BC, where we operate, telemedicine actually has its own billing code for doctors. So like OHIP here in Ontario, we have MSP in BC. There's actually a billing code specifically related to telemedicine that enables us to actually bill at the same rate for basically virtual visits. So those of you that have been to a medical practice in the past, you have to travel there, you have to line up, you have to wait for your doctor. Typically they're running behind. You have to wait in a waiting room with other people who sadly are sick. So you might actually catch a cold while you're waiting in the waiting room. So telemedicine enables you to eliminate all of that. It means you can actually be at your home or your office. And if you just need a quick prescription refill, you can do a digital appointment on your cell phone with your family doctor. It's great for a doctor as well, because a doctor doesn't have to be in their surgery. They can take what would be a 10, 15-minute visit face-to-face in a clinic with someone and do it 2 minutes over a virtual appointment. That's just one element of technology that we're looking to implement into our clinics. Other things, looking at big data, artificial intelligence, looking at things like blockchain technologies to incorporate personal medical records, to put patients at the center of their own healthcare needs. There's lots of technology opportunities out there for us to layer into our clinics. So, our acquisition criteria for our clinics, like I said, we're very disciplined and accretive in the clinics that we're looking for. We're not just out looking to buy any clinics. We're looking for well-managed, well-run family practices, primarily in BC, because we understand the regulatory framework in BC. Like I said, there's also a telemedicine code, so it's very easy for us to implement digital technologies into our clinics in BC. But we have our eye all across Canada. We're being approached by groups here in Ontario, in Alberta, so we will have a platform across Canada eventually. And specifically at the moment, we announced this back in November 2017, we have 6 clinics that we're acquiring, approximately 20,000 patient visits a month with 34 practitioners. Great top-line revenue, highly profitable clinics, creates a real stable base for us to grow from. We'll be a cash flow positive company on day one after these acquisitions. But what's really interesting about these acquisitions, and this is where we talk about the stake in the sizzle, so to speak, having a platform of primary healthcare facilities, the doctor practices, what that enables us to do is then have a distribution channel for our technology. For those of you in the audience that understand technology, especially when it relates to healthcare, you'll know that the #1 challenge that technology companies have in the healthcare space is adoption. It's actually getting doctors to buy into the use of that technology. Doctors inherently are slow to adopt new technology, and that's fine, that's okay. But by us controlling that distribution channel, owning the clinics, and actually having the direct relationship with the doctors, we're able to control the technology that we put into place in those clinics, which I think is pretty exciting stuff. So those are the clinics that we're looking to acquire at the moment. A little bit more detail on each clinic specifically. In terms of acquiring those clinics, we have a templated model that we're looking to buy the clinics with an upfront payment, time-based earnout, and a performance-based earnout for the doctors that we're actually bringing into our portfolio. The clinics that we're buying at the moment, it's about a $2.8 million upfront payment for the 6 clinics that we're acquiring. We've actually just processed a brokered private placement led by Canaccord and Gravitas, and we're really proud to say that that was a heavily oversubscribed financing. There's a lot of interest out there in what we're doing by having this base portfolio of clinics that we're then rolling in digital technologies to layer on top. So a lot of interest out there in what we're doing and the future of what that could be. So as a public company, obviously we have a capital structure. After this latest acquisition, we'll have a market cap of about 24 million based on our current share price. So based on our earnings, that's a pretty healthy cap table at the moment. So in summary, we're an M&A-driven company looking to revolutionize and change how healthcare is delivered within Canada, looking to really improve that quality of patient care experience through technologies such as telemedicine, looking at personal health records. Obviously, electronic medical records is already fairly saturated, but looking at how we help doctors be better at what they do best, which is being doctors, and helping improve the quality of patient care through family practices within Canada. After this acquisition, we're a cash flow positive company. We're just looking for financing for additional accretive M&A transactions. And it's a rapidly expanding industry with lots of opportunities for great expansion. So, whoops, I pressed the wrong button. So if you have any questions, if you want to know more about Well, feel free to give me a call directly. Happy to chat anytime, but check us out, venture-listed company under the symbol WELL. So thank you very much for listening, and enjoy the rest of your afternoon, everybody.